Hi everyone! So this is the second in my series of closet consultations, and I'm going to be discussing acne scars. So there's many different types of acne scars. There's red scars, which are technically actually not scars. So the redness is a result of the inflammation, and that will actually fade with time. But if you want it to go away more quickly, then you can actually use laser that targets the redness, and so that can help the scar look less visible and fade it a little bit faster. So then there's more textural changes, and there's different types of textural changes. What we like to call ice pick scarring is probably the most difficult to treat. So ice pick scarring are those like narrow but very deep scars, and those can either be punched out with like almost like a little cookie cutter, and then the scar that's left behind is a little bit easier to treat with laser. Or you can use a technique that's called cross, where you use a little bit of acid, and that goes inside the scar and it actually seals the wall together, so it closes that scar up. Then there's like atrophic scars, which are like more like divots, and so those respond better to laser treatment, and there's many different types of lasers that can be used, but in general scars require a series of treatments, and so it's usually at least 3 or 4 treatments a month apart to help with scarring, and it does take some time to see those results. So it usually takes up to 6 months to see the full results, because what these procedures do is they stimulate collagen, and they bring in new healthy collagen and remove the scarred collagen. So that collagen remodeling process can take up to 6 months. So again, if you're preparing for an event, like I often see brides or grooms that want their scars to be improved for their wedding, it's important to start ahead of time, because it can take several treatments and it can take some time to see the improvement. So we can actually, do a pretty good job of improving scars. It's never going to look like normal skin, but you can make it look less noticeable. So it's hard to erase scars completely, but you can soften them and make them look less noticeable. But it's definitely an investment in time. It takes several months, and investment in money. It's usually not a one-time treatment. It takes several treatments. So I usually use a combination of approaches depending on the type of scarring that you have. So again, we can use lasers that target redness. We can use lasers that target texture, or you can use one of the newer technologies is like microneedling RF. So it's almost like microneedling with heat or radio frequency energy, and that heat helps to stimulate the collagen remodeling. It has a little bit less downtime than more traditional lasers. So depending on your skin type and the type of scarring that you have, there's multiple different techniques that can be used to improve your scars. So I hope that was helpful, and if you have any questions,